My name is Dr. Jinane Khoury. I'm a dermatologist. I'm a clinical assistant professor of dermatology at the Lebanese American University, LAU, in Lebanon, and I practice at Rosa Hospital and at St. John Medical Center in Jounieh, and as well as the skin clinic in Beirut. And so today, from one mother to another, I'm going to be talking about skincare routines in very, very busy moms. So before being a dermatologist, I'm first and foremost the mother of 3 little children, and I know how little time you have to take care of yourself. So I have a few messages for you. So one, skincare routine doesn't have to be complicated to be effective. So that's the first thing I want you to know. And the simpler it is, the more likely you are to stick to it. So that's a very important point. We don't need you to have a very complicated skincare routine. We just need you to have a simple skincare routine, and then to actually use the creams, because if you don't use the creams, they are useless. So that's the first thing. The second thing is we're going to talk a little bit about how and why do we age, okay? And so basically there are 2 types of aging really. There's one aging that has to do with the factors that are important in your own, genetics. So the way that you age, for example, you look at your mom, you look at your grandmother, you see how they age, and this tells you a little bit about how your genes are formed, whether or not you're going to have a tendency to wrinkle a lot or have very marked expression wrinkles, or do you have a tendency to get melasma or pigmentation on the face. So that's one type of aging. The second type of aging has to do with things that you can actually control. So basically sun exposure. So the sun is the single most important factor that has nothing to do with the way your body is built, but really it has to do with the exposure to the sun throughout your life. And so the sun is the #1 contributor to skin aging when it comes to factors that are from outside your body. 2, there are some behavioral things that you can do, like not smoke. So smoking does increase skin aging. Living in a polluted area does increase skin aging. The type of diet, so very high sugar diets, can also increase skin aging. And there are, of course, some diseases, for example, diabetes will increase skin aging as well. So these are all factors that are outside your genetic, background. So that's one thing. So one thing, before talking even about creams, if you want to age gracefully, it can start by, with basically don't overexpose yourself to the sun, or if you do so, expose yourself to the sun responsibly. So that's one thing, and protect yourself from the sun. That's the most important message. And 2, of course, if you're a smoker, refrain from smoking. You can fix your diet. That would be a very important point. And again, maintain a healthy lifestyle. All of this will play a role in how you age. Now, when it comes to the actual skin routine, what are you going to be using? If I started with the sun, I'm going to start with sunscreen. Okay, so sunscreen is a very important component in any skin care routine when it comes to anti-aging. When we're talking about anti-aging. So one, you should have every morning, whether in the winter or in the summer. Okay, you should apply a sunscreen which is SPF 30 or above. Okay, if you have pigmentation on your face, it would be important to apply also a sunscreen that has some color. Okay, so a tinted sunscreen would help also with the pigmentation or the coloring on your face. And so of course, if you're going to get re-exposed to sun during the day, it's important for you to reapply sunscreen during your day, and that will increase your protection against the sun. And it's important for you not to expose yourself at peak times. So for example, in Lebanon in the summer, it would be between 11 a.m. and 4 p.m. It's a bad idea to go and sit in the sun. So that's an important point. Now, when it comes to the ingredients that we can use for other creams, okay, that we use as anti-aging products, one, the most important family of creams is really the retinoids, okay? And the retinoids are a family of creams that are vitamin A derivatives, so they come from vitamin A. And the way really, so I'm sure you've heard of a lot of them. Retinol is the most common and the most famous one. Retinaldehyde is another one. Basically, tretinoin is a very common cream that we use in acne that can also be used as an anti-aging product. And so these creams, they usually rejuvenate the skin. They can help, improve the texture and the color of the skin. They really usually peel the skin very lightly if they're used effectively. Now, they can sensitize your skin to the sun, so this is why when you apply them in the evening, we make sure to apply sunscreen in the morning. And it's important also, we always tell our patients that if they are going to the beach during, it's better not to apply their retinoids one night prior to the full exposure to sun. Another group, so it's important to have some sort of retinoid in your skincare routine. It doesn't have to be every night. It can be 3 times per week or every other night. That could be enough, to get a good improvement. Another group of creams that we usually use is antioxidants. And antioxidants, the most famous one is vitamin C. And vitamin C is really a very nice cream, or you can find it as a serum as well. So, and this helps with pigmentation, with anti-aging, and it usually is known to give a little bit of a glow, so this is why we also like to use it. And so this is a very interesting ingredient, and it's nice to incorporate it in your skincare routine. Now, these are the basic 3 ingredients that that I would have in any good skincare routine: a sunscreen, a vitamin C product, and a retinol products. Now, sometimes you have a retinol product plus a vitamin C product in one product, so you can just use this one product at night, and in the morning you would apply your sunscreen. So this is the basics of the basics. Now, afterwards, depending on whether or not you have a skin problem, then we would have to change your skincare routine. Let's say you have acne. If you have acne, so I would need to give you a treatment for your acne, and then fix, knowing that sometimes tretinoin, so basically we do give tretinoin for anti-aging as well, but we do give it for acne. So some treatments of acne can be used as an anti-aging product, so that's a very important point. You should know that, for example, if you have other types of diseases, for example, rosacea, okay? If you have a skin disease that's called rosacea, then we would have to treat you also with other products, for example, metronidazole, for example, azelaic acid. All of these products can be added on to your skincare routine. Of course, we try to keep it simple so that you can use your routine without being overwhelmed, okay? Finally, I would like to tell you one thing. So if you're planning on getting pregnant, or if you are pregnant, or if you are breastfeeding, all of the above doesn't necessarily apply to you. For example, tretinoin is not something that you can use, or retinol, you cannot use that during your pregnancy. So it's very important for you to tell your doctor if you're planning on getting pregnant, so that they can tell you which would be the best skincare routine for you. The last part would be other ingredients, okay? So there's a hype around a lot of other ingredients like glycolic acid, and this is a very good ingredient that we use as an anti-aging product. It also gives you a beautiful glow. For example, kojic acid is an important ingredient as well that you can find in serums, you can find it in creams, and this is also important for the glow. You would apply it in conjunction with the others. And very, very importantly, for example, bakuchiol, you will hear about it a lot. So this is also an ingredient that works like retinoids, but it has less side effects. So whenever you come across, a new ingredient and you're curious about it, I would suggest that you read about it, ask your doctor about it, and see whether or not you can incorporate it into your routine. But importantly, keep it simple, because if it's not simple, you're not going to use it. And if you're not going to use it, it's not going to be effective. So keep things as simple as possible. Don't guilt yourself, okay? You're doing the best that you can. And really, from one mother to the other, I will tell you that skincare routine, it doesn't have to be complicated. Just try to stick to 1 or 2 or 3 creams, use them. And if you've forgotten them for one night, it's fine, but try to be as adamant, as regular as possible in your routine. and good luck.